take you on a journey of empowering change, restoring communities. That's our vision statement, but it's also our passion to see communities restored and changed through bringing hope to people that feel hopeless. We want to bring hope to them and help make a world of difference in their lives. You can be involved by donating funds or gifts in kind. What we really need is not just the one-off donations, but we need people to give regularly. This enables us to be able to manage our programs, to budget them and organically grow through sustainable. Many people giving $5 for going a coffee, for getting their cappuccinos, every week giving $5 will make a massive difference to the lives of the people. You'll also be involved by going. We have mission trips, humanitarian trips that go to the Philippines and other countries, make a difference in those communities. So I encourage you to be a part of those teams, whether you have a skill or not. We can have tradespeople, nurses, doctors, but also anybody that can go and make a difference and bring hope will be a big part of the change we need. And what if you can't go or give? I encourage you right now to become an advocate. We are needing advocates who will not only share our pages and have birthday fundraisers, but also to be able to have fundraisers themselves and help raise money for the cause and advocate on behalf of the people that are struggling. Thank you very much in advance for your help. And let's all together empower, change and restore communities. God bless you heaps, guys. I appreciate you all.
Must be nearly ready. Well, good evening, everybody. How great to be with you once again for 5 Q&A. My name's Pastor Glenda from Create the Change Foundation, Australasia, and we're in for a very, very special night tonight. My special guest for tonight is Dr. Mate Tobacco from Vegan Ilocos Sur. Is it Ilocos Sur? In the Philippines. That's up in the north of the Philippines. Dr. Mate has just retired from her position as a physician at the hospital after 31 years of service. But she's only retired from that position. Some would, after years of service, take time off and rest and relax. But not Dr. Mate. She's not like some. In fact, she is not like most. While she was working full-time, she also conducted free medical clinics locally and across the nation to provide assistance for those who could not afford a doctor or could not afford to buy medicines. And I have it on really good authority that since the year 2000, she has done over 400 free medical clinics. In fact, I think it's more than that, but they've lost count. You know, on Facebook, my Facebook this week, there was a memory from 2017. There were photos of one of the medical clinics that I had the privilege to participate in, held at Mahayag Elementary School with COC Isabel in Leyte. And you know, in one day, just one day, 218 families got medical attention and prayer. And that night, over 100 children joined with Brisbane's Dan Warlow for some great music. And there's many children also had a meal and received a special gift that was sent over from Brisbane's Dorcas ladies. You know, these clinics are more than just about physical health. And that leads us to some of our questions tonight. So let's find out a little bit more about these medical clinics and what Dr. Mate has been doing. Dr. Mate, welcome. And I'm just wondering, can you tell us a little bit about these medical clinics, who you get to see, how you get to help them, and what does that do for the people in that community?
Whenever we go on medical missions, we always encounter a lot of different people with different health conditions who are badly in need of medical attention. Mostly elderly patients who are hypertensive. They know that they are hypertensive and yet not taking any antihypertensive drugs because they don't have money to buy their medicines. So after talking to them about their conditions, and when they receive their medicines, we see in their faces that they are very happy. Happy because we give them their entire dose. Example, if they need a maintenance medicine, we give them 30 tablets. And for antibiotics, we give them a complete dose for 1 week. So when we go to the communities and reach them out, they grab that opportunity at once. I'm sure that those little things that we do to them creates an impact in their lives and to the whole community as well. Yeah.
Wow. It just that amazes me to think that, that there are people who know that they're not well. They know that they've got high blood pressure, hypertension. They know that their children are unwell, and yet they cannot afford to go to a doctor, or they cannot afford to have medicines, and for people like yourself to be able to supply and to do things like this for these people is just incredible. But one of the things, I know you're just one person, so I know one person can do only a certain amount. And so my next question to you is, who helps you in these clinics? Who gets involved in providing all the resources for them, for these clinics?
We started with the Global Care, then the Create the Change Foundation through Pastor Russell Wright, who has been working with us since we started in the year 2000. And up to now, up to this present time, they are supporting us with a certain amount monthly. And also they are assisting us in some of our programs like the flagging program. We also have the Community Care Brigade as our local counterpart, and some friends here and abroad who are faithfully supporting us financially and materially. I also personally solicit some sample medicines from my medical representatives through their pharmaceutical companies and some of my personal friends. That's where we get our support.
Wow, that's amazing. So it's from your own personal friends and contacts. It's from people overseas. You have other volunteer doctors, and I do recall that when I came and assisted with the medical clinic down in Leyte, your whole family was there. Your husband, your son, your daughter, Lord, everyone was there helping, and just amazing. It's amazing what we can do when we all join together, isn't it? Here's another question. How can you tell us maybe a story, maybe something about one person in particular that you remember that really impacted you and that benefited from one of your clinics?
I remember one of our medical missions here in the province, wherein an elderly adult woman came to me with a severe skin allergy. She told me that she had been taking medicines on and off, but still to no avail. No improvement in her allergy. So when I examined her and gave her her medicine, she said, I already tried taking that medicine, she said, but still I gave it to her, and our prayer warriors prayed over her. And you know what? Several weeks later, she personally came back to us. No more skin allergy, and she was so happy. She asked me this question: why is it that I took the same medicines on and off and I didn't improve? And when I took the medicine you gave me, I was healed, she said. So I answered her, yeah, it is not the medicine, but of course it is the prayer that worked and Jesus healed you, I said. That's what my answer to her. She was so happy, no more allergy. Yeah, she came back to us.
That is awesome. I remember you told a story about the little boy that was having seizures. Can you tell us that story? Hang on, doctor. You could. Yeah.
In one of our medical missions, also somewhere, also in this province, we were having medical mission, and then suddenly there was a commotion. So I went to see what was happening. There was a little boy, about 4 to 5 years old, brought by her mother, who was convulsing. According to the mother, she already had the fever for about 3 to 4 days, but they cannot bring the child to a doctor. So when they heard that there was a medical mission going on, she rushed her child to that venue, and then uh, we took care of the child. While doing the first aid of his convulsions, Pastor Rene and some of his team also prayed over for the little boy. And then slowly, his convulsion was really hard because his body was already stiffening, his eyeball rolling up and down, and only the white or the conjunctiva of his eye is being seen. His saliva was drooling in his cheeks. And then Pastor Rene prayed for the little boy, and slowly his convulsions stopped. Although he still had the fever, his convulsion already stopped. So I gave him I examined him and then gave his medicine and some vitamins. And then the mother and the child were so happy. But after that, while the child was relaxing or resting, our counselors talked to the mother, counseled her, and led her to the Lord. And they explained to her that we were just instruments of His healing, and it is the Lord that heals them.
That is so true. So, prayer is a big part of what you do, isn't it, with your medical clinics? It's not just medicine; it's medicine and prayer as well. Here's another question. I noticed that just last year, the Create the Change Australasia, in partnership with the Community Care Brigade, actually purchased a van for use for a mobile medical clinic. I saw some pictures up on Facebook, and And now I hear and see that you and your church, your husband, and all your community in the process of building not one but two exclusive buildings for medical clinics, where you will continue to volunteer your time. So tell us a little bit about who will be attending those clinics, and also how you will use the van. What's the vision for that?
Yeah, as I have said earlier, most of the patients come from the less fortunate families in the communities. Those who have no access to go to visit a doctor because of lack of money. Sometimes during my mission, I even encounter a whole family who comes to seek medical attention. The most common medical need that I encounter in the barangays or medical condition is, of course, cough and colds, hypertension, and even some skin disease. That's where most of our medicines are allocated for cough and colds, fever, like that. And about the van, it is very useful in transporting our volunteers and our medical supplies to far-flung areas. It is also very useful to carry out patients, especially PWDs and their children, and also pregnant mothers to our venues. That's where the van is being used, and it also serves as an emergency vehicle for those who are in need of going to the hospital who doesn't have any available ride. And the van has a designated driver who is only allowed to drive the van so that he can take care of it also. That's where the van is being used.
Wow, that is amazing. So it's used for transporting medicines, it's used for transporting volunteers, it's used for transporting people with disabilities, it's used for transporting pregnant mothers, it's used as an ambulance if somebody needs to go to the hospital. And here's a question. How much do you charge a patient for a consultation? Or how much does it cost them to use the van?
Of course, if it is on medical mission, we do not charge a single centavo.
Exactly.
I think I can compute the costing. Example, about $10. We'll be able to supply a medicine of one child, a vitamin of one child for the whole month. Yeah. And for medical mission, we budget at least maybe $10 to $12, wherein they already have the complete medicines for their common illnesses.
Let's just clarify that. So $10 supplies the medicines and the vitamins for a child for one whole month. Yes, and $10 to $12 is what you budget for people when you go on the medical mission to cover your costs. But you don't charge that money. You don't. That's what it costs you, but you don't charge that. So of course the question is then, if people don't support this, how could you do this? You cannot. True?
Sometimes if it's just a little amount, we can use our personal money. But if it needs a big amount, of course, we need supporters. Yeah.
Wow, that's extraordinary. So people can be involved in the medical mission by supporting you financially. That helps to buy medicines. It helps to pay for the fuel for the vehicle to help you to get to the clinics. Obviously, it helps to run your own medical clinic. Tell me a little bit about the fogging. About you mentioned fogging before. Tell our listeners what that's about.
A fumigation program. We do this in schools or in a household where there is a diagnosed case of dengue fever. We use chemicals and diesel to use in the fogging machine. And that chemical costs about 6,000 for 1 liter. That is the requirement for the fogging.
So how often do you have to do the fogging?
Not open because when they request to us, then we do it. It is done early morning or late in the afternoon.
Wow.
If we receive some requests, then we do it.
Good. How far, with your medical missions and your teams, how far have you traveled? How many hours? What's the furthest away that you have gone to do a medical mission?
As far as Isabel Leyte, yeah, wherein we had to take, we took a plane. We brought all, and here we also go to Cagayan, that is about 12 hours drive from our place. That is the farthest we reach in this, in our nation. Oh, by the way, I remember we also went to Cebu. We tried going to Cebu. Yeah.
I actually remember, I think it was when we went to Leyte, your vehicle didn't quite make it home. Is that correct?
We were going home. It got stuck. It had problems.
And if I recall, I think a miracle happened that on that trip to get you home, by somebody coming and giving you transport or something like that, where you were stuck.
Yeah, we were stuck and it was raining hard because there was typhoon at that time. And one of our members who had a van came to rescue us. And we left the car in that place. They rescued us. They brought us home. So that was the miracle that happened to us, because even my granddaughter was with us, who was 6 years old by that time.
Wow. Wow.
Yeah.
So there is nothing really that stops you from going to do these missions. You just go. Yes. So
As long as my health is good, then we can go. No hindrance. Yeah.
amen.
The
No
Lord
hindrance
is always
at
with
all.
us.
Oh, here is a good question for you, Dr. Mate. Here is like, how do you still have the energy to conduct medical consultations and build your own clinic even after retiring from the government service? So it's just, how do you have the energy to do all of this?
God gives me the energy because I love doing medical missions. I am used to doing medical missions since I started my practice. I also work in a rural health unit. That's why I know that our patients there are also come from the less fortunate group. As long as I have my energy, I love to do medical missions. Yeah, that's what here in the house and one at the church. That's where the two clinics are. One in our residence and one in the church. And people
So,
call me by appointment, then we have to go to the church like that.
so do you actually have a day off, Dr. Mate?
Come again?
Do you get a day off?
Day off? No day
A day
off.
off. No day off.
Monday is our supposed to be Monday was our day off, but if somebody calls, then we have to go. Full of duty. Yeah.
Wow. Wow. So nobody gets turned away.
Mm-hmm.
Okay. Here is another question for you, Dr. Mate. What is your advice for those who would like to pursue being a doctor and conduct medical missions?
I didn't get the question, Pastor Glenda. Come again.
All right. I'll ask again.
Advice for?
Yep. For those who would like to pursue being a doctor, so they'd like to be a doctor and they would like to do medical missions, what would be your advice for them?
Well, they have to commit everything that they do to the Lord, and the Lord will do everything for them. They should have the desire, and they should love doing missions. If you don't love mission, then it's impossible. Pastor Glenda, I would like to share something, no? One time, we invited a dentist to join us in our medical mission. And you know what she told us? I'd rather take care of my pigs and go to their pig pen, she said. What a disgusting answer. Yeah, and you know what? Not long after that, maybe about 2 months after, she had a heart attack. Yeah,
Yeah,
so bad.
yes. You
That's
cannot,
why it's really hard to invite doctors also if you know that their heart is not in mission. It's so hard to invite doctors. It's good that we have two doctor members also in the church who helps me in the mission. Yeah.
that is very good.
Yeah.
Yes. I've just got an announcement that a donor just gave us $500. Thank you for that person watching. $500 goes a long, long way. And if you'd also like to give, if you're watching tonight and you'd like to give, just follow the link below, and that will guide you through the process of how to give. Every dollar that's given is used for the purpose that it is given. So if you give $1 to a medical mission, the dollar goes to the medical mission. And as I've said before, I've actually been on one of these medical missions, and I've been on a couple actually, but I see the work that gets done. And Dr. Mate, I just want to say thank you on behalf of not just the Create the Change Australasia, but on behalf of all those people that you help. I watched you in Leyte work tirelessly. Like I said, one day there was 200. I think we saw nearly 800 people by the time we'd finished that mission. And you could no longer write anything on their medical card because you had got a cramp in your fingers from working so hard. But I just want to say thank you, thank you, thank you for your tireless work. And thank you to your other medical doctors that are part of your team for also giving. You change people's lives. You changed my life just by being there and watching. So thank you so much for everything that you do.
No problem. As long as we have the things to use, then no problem.
Well, thank you for joining us tonight, and I really pray that we get to see each other face to face, where we can actually give each other a hug. This is nice, but it's nicer when we're together. But until we do, we just want to pray and thank you. And so, Father God, I thank you for Dr. Mate. I thank you for her church and family. I thank you for Pastor Renee, Father God, and the work that they do. I just ask, Lord God, that you continue to give her great health, continue to strengthen her, Lord God, as she goes, continues to give every single day to people in need. And also, I just want to say thank you to everybody that is giving today, tonight, tomorrow. Your dollar does make a difference. It buys medicine, it buys vitamins, and it changes people's lives. So thank you once again, Dr. Mate, and thank you everybody for joining us. God bless you all, and good night, everybody.
I'd like to take you on a journey of empowering change, restoring communities. That's our vision statement, but it's also our passion to see communities restored and changed through bringing hope to people that feel hopeless. We want to bring hope to them and help make a world of difference in their lives. You can be involved by donating funds or gifts in kind. What we really need is not just the one-off donations, but we need people to give regularly. This enables us to be able to manage our programs, to budget them and organically grow through sustainable. Many people giving $5 for going a coffee, for getting their cappuccinos, every week giving $5 will make a massive difference to the lives of the people. You can also be involved by going. We have mission trips, humanitarian trips that go to the Philippines and other countries, make a difference in those communities. So I encourage you to be a part of those teams, whether you have a skill or not. We can have tradespeople, nurses, doctors, but also anybody that can go and make a difference and bring hope will be a big part of the change we need. And what if you can't go or give? I encourage you right now to become an advocate. We are needing advocates who will not only share our pages and have birthday fundraisers, but also to be able to have fundraised themselves and help raise money for the cause and advocate on behalf of the people that are struggling. Thank you very much in advance for your help. And let's all together empower, change and restore communities. God bless you heaps, guys. I appreciate you all.